As a sailor, I used to race boats quite competitively, and I was racing during the summer of 2006, but noticing an awful lot of pain in my hands and my feet. That was getting gradually worse and worse. And the second thing, which sounds absolutely hilarious when you look back on it, was being at a 40th birthday party for a girlfriend of mine and being in charge of the barbecue. And trying to turn food on the barbecue just became impossible. And at the time you're thinking, well, what on earth is this? You just wave it away and think this is just silly stuff. But when I look back now, it was one of those symptoms of my hands just seizing up and getting very stiff and struggling with what I know now to be rheumatoid arthritis. It took me a while to go to the doctor. For a while I just put down the symptoms I was having to being overactive, doing too much sport, not enough rest. Getting to a diagnosis took quite some time for me. And part of that was my delay in getting to a GP, because I thought that some of the symptoms I had would just go away. Actually, it took a GP a long time to recognise that there was anything serious wrong with me. And I had at least 3 trips to the doctor before somebody said, actually, I think there's something wrong here and perhaps we need to refer you. I work in the city, do a lot of computer-based work. My GP said that I potentially had RSI, so I was doing an awful lot of work on my computer, and it's quite widely recognised that that can be one of those problems that you suffer with. When I started to have problems with my feet, actually I was starting to put 2 and 2 together before he did. And I then went back to my GP and actually suggested that these 2 things might be connected, and he actually said no, they're 2 entirely unrelated things, and sent me away with a list of exercises to do. Mornings, if you have rheumatoid arthritis, can be an absolute nightmare. And one of the major issues I had at that time was actually getting down the stairs. I used to have to come down the stairs on my bum, because it was the only way I could get down the stairs. I couldn't put one foot down in front of the other, and I couldn't grip a banister either because my hands were so painful and so tight. It wasn't one of my favourite times of my life. I did end up in tears with the GP and really start to beg somebody to take this seriously, and gratefully at that time I actually saw another GP who said, I think there's something serious going on here, and got me a referral. From then on in, things started to move quite a pace, and even on my first appointment the rheumatologist suggested that it might be rheumatoid arthritis. I take quite a combination of drugs now. I take steroids on a daily basis. I also take methotrexate every week, and then I inject one of the new biologics once every couple of weeks. They're expensive, but they really work for me. And the good thing is that there's a lot of research going on at the moment about those drugs. I have a long-term condition that I have to get used to. It's part of me, but it's not all of me. And I think now that my treatment is working well for me, then that means I can put it in its place.
It's tragic to hear Jean's story, but unfortunately it's not that uncommon. And I feel very sorry that Jean has suffered for so long because of a delaying diagnosis. Rheumatoid arthritis affects the joints of the hand by causing swelling and tenderness of the joint capsule, but it can also cause little cavities in the ends of the bones aligning the joints, called erosions, and these erosions can lead to significant damage and destruction of the joint and, in time, disability. Few GPs receive adequate training in spotting the earliest signs of rheumatoid arthritis, and in fact few GPs have any training at all in rheumatology during their hospital training. Most GPs in fact are not aware of modern research which shows the benefit of the newer drugs, including immunosuppressives and biologic drugs. These drugs can stop erosion developing, and crucially they can enable patients to return to work as quickly as possible and carry on with their normal activities of daily living. There is no specific diagnostic test for rheumatoid arthritis. What we need is a good, rapid referral to the specialist by the general practitioner. Specialists, when they get these referrals, prioritise them, and the patient will be seen within a matter of weeks. Patients themselves have some responsibility. They often delay seeing their general practitioner because they feel nothing can be done for their arthritis. But when these patients go to see their GPs, if their GP does not refer them, then they should request a second opinion so that the specialist can see them and investigate them as soon as possible. Here is a useful reminder if you feel you may have rheumatoid arthritis, the S factor. If you have stiffness, in other words, if the joints in your hands are swollen and stiff in the morning for 30 minutes or more, if you have swelling, persistent swelling of one or more joints, and if when you squeeze the joint you have tenderness or pain, if you have any of those S's, you could have early rheumatoid arthritis, and it's essential that you see your doctor as soon as possible. So with early treatment you can return to a normal life, but don't just take my word for it. Here's Jean with the last word.
Early diagnosis can make a real difference in the treatment of rheumatoid arthritis. So insist on a referral to a specialist. Take a family member or a friend with you if you think it will help. It can make a real difference to the quality of the rest of your life.